While Discovery and Metropolitan fight for size, they have also been working quietly behind the scenes as the NHI looks imminent. Originally, government was going to manage all claims and processes on its own, with an initial cost of 30 billion rand just to set it up. But now, analysts say government could turn to the private sector to administer the country's 47 million people.
I think that the government is quite committed to not losing any of the expertise in the industry, and they've said that publicly. They want the private sector to work with them.
And because of the sheer scale of their administrative businesses, Metropolitan and Discovery are likely to benefit big time from the National Health Insurance Plan.
All the constituent parts that you will need for national health insurance can be found in the learning that we've experienced with GEMS. I think the other interesting thing is GEMS is starting to, or our relationship with GEMS is starting to demonstrate to government that you can use public-private partnerships very efficiently to bring new healthcare funds into existence, and national health insurance will certainly be one of those new healthcare funds that is going to be covering a broader population in South Africa, and I think we can play quite an interesting role in that.
And I think very involved in the process, very involved in a lot of the thinking. I don't think it does. I think that change always poses risks and opportunities, but I think that when the dust settles, you're going to have all kinds of systems working together. And again, I come back to the issue of size and capability. I think we have a lot to offer and share in helping build the system, and we're committed to doing that.
So where does that leave the smaller guys if consolidation is inevitable? On the one hand, there is less competition. On the other hand, lower administrative costs and better savings.
As a consumer, in needing to choose a medical scheme, there is quite a lot of choice, and it's quite confusing. And then in terms of the administrators, I think there are about 20 administrators, another roughly 16 self-administered schemes. All that translates into higher costs. I think it would be favourable if NHI was able to achieve some consolidation and some cost reductions.
The other big administrator is MedScheme, which isn't listed on the JSE. One analyst suggests that if government were to put the administration of the NHI out to tender to private companies, the industry would consolidate to the extent that there would be just 3 major administrators left. The 2 big ones will be Discovery and Metropolitan, and then a third contender, a company with a massive distribution network and deep pockets, some 3.5 billion rand deep to be precise. Sanlam is the country's second biggest life insurer, and it re-entered the medical aid scheme industry in 2007. Currently in the healthcare space, it doesn't have much clout, but it's looking to gain some. It wants at least a 5 to 6% market share over the next 5 years, and it plans to achieve this through some serious aggressive acquisitions.
Although I may not be in a position to share with you which one we are about to close a deal with, but I can tell you now it's a very good fit for our strategy, not only from a Sanlam Health perspective, also from a Sanlam Group perspective. And I may not comment on who else we're talking to at this stage, but I can tell you that we have clearly cut a mandate that we should go for the candidates that will provide the best fit for our strategy, even going outside of Africa if there is an intent to do that.
So what are the chances of a major acquisition of MedScheme by Sanlam? And how successful could Sanlam be in an environment with a formidable competitor like Discovery?
Sanlam has stated that they want to enter the medical scheme administration and managed care market, so I think the odds of them buying MedScheme is definitely more than 0. I mean, I haven't heard anything specific about that deal. At the same time, it sounds very simple, but it is not. I mean, big insurers like Old Mutual have tried to compete with Discovery head-on, and they have failed. You must remember that medical scheme administration is a very admin-intensive business. Compared to life insurance, where you collect premiums and the client calls you once every 10 years. In medical schemes market, you have this constant interaction between yourself and your client. So I think Sanlam will want to compete. They might be successful, they might not be.
The overhaul of the health sector could also have repercussions for other industries. The relationship between life and medical aid businesses is somewhat incestuous. Most life businesses run medical scheme units. And the recent Metropolitan and Momentum Life merger could spell a similar fate for the medical scheme businesses as well.
From our side, we currently are about 26% of the currently insured market, and Momentum is about 5%. So together, it's an exciting merger opportunity. They also do operate in different markets. The Momentum Health Group operates predominantly in the open medical aid scheme market. Metropolitan Health Group is a dominant player in the restricted medical aid scheme market. So I think it's almost a nice fit in terms of a merger. But yeah, it's going to be exciting. I think it also positions us around the earlier comments I made in terms of being in an environment where we have a very large balance sheet partner that can support us in the future expansion of our organization.
For Discovery, the group's life unit is the second biggest contributor to profit. It's heavily intermediated and growing rapidly, and there are concerns that this business could be negatively impacted by healthcare reforms.
I think everybody agrees with me that the health business is wonderful and sort of in a strong position. The life business divides people's minds because it's grown rapidly in 10 years to become quite a major player in its segment. Problem is it hasn't made a cent of money yet. It's been cash flow negative for 10 years because of this rapid growth. And a lot of people are nervous that if, let's say, healthcare reform takes place in South Africa and it means that people's disposable incomes are hit, if it means that more people emigrate, anything that will lead to higher withdrawals out of that life business, it could mean that this cash is never recovered. So I think some people are saying that healthcare reform might affect negatively on Discovery's life business down the line.
After the break, the aim of the National Health Insurance Scheme is to give access to better healthcare in South Africa for all of its citizens. But can it solve some of the fundamental challenges in the private healthcare industry, like competition and regulation? Are there more opportunities than not? And are companies hedging their risk overseas as the deadline for the white paper looms? Find out right after the break.